at the U.S. Food and Drug Administration with the Division of Drug Information Pharmacists. Today, they are discussing the recently announced Risk Evaluation and Mitigation Strategy, or REMS, for rosiglitazone-containing products. This is FDA Drug Info Rounds, a program by pharmacists for pharmacists.
Do we know what impact the REMS is going to have on pharmacists?
Yes, we do. The medication guide is available now and should be distributed to patients with each prescription. Their healthcare professional and their pharmacist letters will also be sent within 60 days of REMS approval and will address the time frame for implementation of restricted distribution. So when the REMS is fully implemented, rosiglitazone will no longer be available in retail pharmacies. It is also important to note that FDA will be monitoring and assessing the program.
That's right. The REMS will be designed to ensure the benefits of rosiglitazone outweigh its risk in patients with diabetes. It consists of a medication guide, a communication plan, elements to assure safe use, and an implementation system.
The REMS is being required because studies have raised concerns that rosiglitazone may have the potential to increase cardiovascular ischemic risk.
And the main question raised by these studies was, does rosiglitazone increase the risk of heart attacks compared to placebo or non-glitazone diabetes drugs? Unfortunately, we still don't have a clear answer.
You're right, Chris. Many highly experienced scientists have examined these data and found it difficult to form a definitive conclusion. Yet they agree that the data on pioglitazone, the only other approved drug in the class, do not suggest a cardiovascular risk, but do suggest other risks.
Rosiglitazone is sold as the single-ingredient product Avandia. It's also available in combination with other diabetes medications as Avandia and Avandaril. Pioglitazone, or Actos, is the only other TZD drug available as a single-ingredient product or in combination with other diabetes medications. After consultation with a healthcare professional who has considered and advised the patient of the risks and benefits of Avandia, this drug is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus, who either are currently taking Avandia or not already taking Avandia, but are unable to achieve adequate glycemic control on other diabetes medications, and in consultation with their healthcare professional, have decided not to take pioglitazone or Actos for medical reasons.
FDA's review of rosiglitazone started in 2006 when a group of related meta-analyses of cardiovascular ischemic events and deaths in studies comparing rosiglitazone against placebo or other non-TZD anti-diabetic drugs first brought attention to this issue. An updated meta-analysis completed in 2010, including 52 trials, again found an increased risk of myocardial infarction with rosiglitazone.
The data underlying the cardiovascular ischemic risk of rosiglitazone are concerning, but they're not definitive. The meta-analysis of 52 clinical studies with a mean duration of 6 months and a total of 16,995 patients, most of which compared Avandia to placebo, showed Avandia to be associated with a statistically significant increased risk of myocardial infarction. 3 other studies with a mean duration of 46 months and 14,067 total patients, comparing Avandia to some other approved oral antidiabetic agents or placebo, showed a statistically non-significant increased risk of myocardial infarction and a statistically non-significant decreased risk of death. Clinical trials have not shown any difference between Avandia and comparator medications in overall mortality or cardiovascular-related mortality.
It is known that rosiglitazone can effectively control blood sugar. However, in the interest of patient health, FDA has directed GlaxoSmithKline to require additional safeguards and restrictions for its use.
The reasons for restriction rather than market removal include 1. There are individuals with type 2 diabetes who may benefit from therapy with a TZD because they are unable to achieve glycemic control on other medications, but who cannot tolerate pioglitazone or for whom it may not be the best medical choice. And 2, there are individuals currently taking rosiglitazone who, with full knowledge of the potential risk and in consultation with their healthcare professional, may wish to remain on it rather than revise their treatment regimens.
As the REMS is implemented, pharmacists will be on the front line helping patients and providers understand the benefits and risks of rosiglitazone.
Thanks for joining us. This is our FDA program of pharmacists helping pharmacists educate consumers so they can make better medication choices. To learn more about today's topic, visit the FDA website at www.fda.gov/drugs.